Hi, my name is Daniel Aloise. I'm a medical student from the Florida International University, Herbert Wertheim College of Medicine in Miami, Florida. Partnered with Dr. Guillermo Izquierdo, we created an article entitled Uncertainty of Liver Cirrhosis Diagnosis and Use of Elastography, a case report. This poster is based on a case of severe jaundice in a patient with a long history of alcohol abuse, which led to a questionable diagnosis of liver cirrhosis. In order to determine its diagnostic utility in the setting of liver disease, we used elastography on our patient to confirm the clinically suspected diagnosis of cirrhosis. So we had a 59-year-old male who presented to our emergency department with 2 days of progressive jaundice and right upper quadrant pain. The patient admitted to drinking more than 500 milliliters of vodka daily for 7 years, with his last drink on the morning of admission. Physical exam revealed a man in mild acute distress with severe jaundice and an abdomen diffusely tended to palpation. 2 spider angiomas were present on the torso, along with caput medusae and mild asterixis. Labs revealed elevated AST and ALT with a ratio greater than 2 to 1, a prothrombin time of 16.3, prothromboplastin time of 36, albumin of 3.7, elevated lactate of 2.6, significantly elevated total bilirubin of 22.6, and direct bilirubin of 19.9. We also had an elevated MELD score of 22 and MADRS score of 37, indicating poor prognosis in our patient. Ultrasound revealed mild hepatosplenomegaly with no sign of pancreatitis. The past medical history was insignificant aside from the fact that the patient is homeless and drinks more than 500 milliliters of vodka daily for the past 7 years. On admission, our patient was hemodynamically stable, alert-oriented ×3, and mild acute distress. He exhibited 5+ severe jaundice, including the sclera of his eyes, his torso, thighs, all the way to his hands and his feet. So, our patient was last admitted to the emergency department 6 months prior due to altered mental status. He was treated for alcohol withdrawal and diagnosed with chronic alcoholic liver disease. Based on his history and physical exam findings from his current admission, a diagnosis of acute alcoholic hepatitis and hepatic encephalopathy exacerbating an underlying liver cirrhosis was suspected. However, we had not yet confirmed this diagnosis of cirrhosis. We used elastography to do so. So what is elastography? Elastography is a novel and underutilized diagnostic tool that can diagnose fibrosis and cirrhosis by means of ultrasound. As opposed to the current gold standard of liver cirrhosis diagnosis, which is liver biopsy, where they take multiple biopsies from multiple lobes of the liver, a very invasive procedure, elastography is non-invasive, inexpensive, and highly effective at diagnosing fibrosis and cirrhosis. So, through the use of ultrasound-mediated shear wave technology, we measured the mean velocity of transmission in our patient to be 1.77 meters per second. So what does this mean? These waves were traveling through the liver at a speed faster than what's typically seen. So, elastography is based upon the principle that these waves travel faster through stiffer, more elastic tissue, as in the case with liver fibrosis. The native hepatocytes are replaced by more fibrotic tissue when they are exposed to chronic alcohol use. This mean velocity of 1.77 meters per second is consistent with a Medivir score of F equal to 4, which indicates significant fibrosis and is consistent with the diagnosis of liver cirrhosis, as seen in the image on the left and the bottom, where you see red, yellow, green, heterogeneously admixed, indicating fibrosis. Next to that image is a homogeneously blue liver, which is my own, which measured 1.33 meters per second with a Medivir score of F equal to 0, just for comparison to show you a normal liver. So our patient likely presented with his acute alcoholic hepatitis and exacerbating his underlying cirrhosis, which led to hepatic encephalopathy. Cirrhosis is an increasingly prevalent yet underdiagnosed disease with very poor prognosis. It is the 12th leading cause of death in the United States, yet less than 1 in 3 people with cirrhosis even know they have it. Often irreversible, this condition can have many life-threatening consequences, such as hepatocellular carcinoma, hepatic encephalopathy, hepatorenal syndrome, and much more. So, elastography shows promise as a non-invasive and inexpensive diagnostic tool as opposed to the current gold standard of cirrhosis diagnosis in terms of liver biopsy. We have yet to have another tool emerge as the gold standard alongside liver biopsy. This case illustrates the clinical utility of elastography as a readily available tool for patients with suspected liver fibrosis. Paired with clinical and laboratory findings, elastography can efficiently diagnose or rule out cirrhosis, thus enabling clinicians to provide patients with optimal therapeutic regimens and appropriate screenings to ultimately improve patient prognosis. Thank you.